My name is Destiny Crosby, and I'm going to be doing the colostomy bag change. First thing I'm going to do is check my MAR before I enter the room, make sure that I am entering the correct patient's room. I'm going to knock on the door, perform hand hygiene, provide privacy. Hi, my name is Destiny. Can you give me your name and date of birth? Alright, once that is correct, I will tell the patient what I'm going to be doing. Alright, so we're going to be putting on our gloves. We're going to make sure that the patient is in a low lying position. And we're going to ask them, are you comfortable? Yes, okay. Alright, first thing we will do is check to see if the bag needs to be emptied or not. Alright, so when we remove the bag, there's a little clip you will just pull up and you go around and lift up. Alright, the bag needs to be emptied. You will then empty the bag and then we will toss this away. Alright, and next we will remove this part. And you want to make sure you go towards the center to not cause any irritation. And we would throw that away as well. Then we would remove our gloves and toss that away. Perform hand hygiene again. We're going to put on some clean gloves. This next part, we're going to be just cleaning around the stoma, going around in a circle. We always make sure we check for any discomfort, any discoloration, or anything like that. Put that into the dirty linen. Next, we'll dry it. Dirty linen. Alright. So next thing we need to do is measure our stoma. Okay. So we have our paper here. We will see which one we think fits best. Alright, I'll go with the 1/3. We would then take our stoma part. There's a covering that's on the back. You would hold it up and cut out the correct position part. Alrighty. So while we would be cutting that, we will be taking our prep and putting it around the stoma while we let that dry. Okay, so that has dried. We have cut out the proper size. I'm going to hold it up, make sure that it fits correctly. Knowing that the skin prep has dried, I will place this on. You want to go around to seal. Then we will take our bag and flip it onto the bag. Make sure that we close the bag. Alrighty, we asked the patient if they're comfortable or not. They said they are comfortable. Alright. We're going to remove our gloves, get the patient back in a good position, perform hand hygiene, document everything that has happened, and let the provider know if we notice anything that should be told to them immediately. Thank you.